Good afternoon, Dr. Laposata.
Good afternoon.
Are you on point now?
You are.
You were asked on direct examination about your qualifications. You were a medical examiner for the state of Rhode Island, is that fair to say?
Yes, I was the chief medical examiner.
For 20 years?
12 years.
I'm sorry, 12 years. When's the last time you worked as a medical examiner?
In 2005.
When's the last time that you conducted an autopsy?
I've done probably a handful of autopsies, private autopsies in my consulting practice.
Since 2005?
Correct.
When do you think the last time you did one is?
Maybe 4 years ago, four or 5 years ago.
4 or 5 years ago?
Yes.
Okay. Since you left the medical examiner's office, have you had any specialized training in brain injuries?
It's all part of keeping up with the medical literature and knowing the forensic pathology literature, reading medical literature. So it's a continuing endeavor to keep yourself educated with medical updates.
Since you left the medical examiner's office, have you had any specialized training in brain injuries?
I've not gone to a course on brain injuries.
Since you left the medical examiner's office, have you taught any students on brain injuries?
Yes.
Have you given any classes or seminars on brain injuries?
Yes, I have.
And coup counter coup, how many times have you experienced that as a medical examiner, that condition?
Well, I myself haven't experienced it, which was good. But in cases, hundreds of cases, it's a common injury.
You said you did differential diagnosis. That is to exhaust any potential bias you have, correct?
Well, a differential diagnosis is to think, how many ways can you get this finding? And it does help prevent bias.
Did you say on direct examination part of the benefit of differential diagnosis is to make sure that you don't have a bias?
Yes, yes.
In order to eliminate bias, you're supposed to look at all reasonable alternatives, correct?
Yes, that's part of it, making a differential diagnosis.
So you don't just look at a person's body, come to a conclusion, and ignore other evidence. That would kind of defeat the purpose of differential diagnosis, wouldn't it?
Well, you always have to look at all the evidence.
And so if you didn't look at all the evidence and you disregarded some of the evidence because you had already made up your mind, that really wouldn't be the proper study of differential diagnosis, would it?
Right, I don't do that.
I'm sorry, ma'am.
I don't do that. I always look at all the evidence.
And would you look at all the evidence even if it was contrary to whatever opinion you wanted to give in court?
Well, the evidence allows me to come to an opinion. So it's not like I decide on some opinion I want to give and then look for the evidence. The evidence is going to tell me what happened to the body.
So you would never say, like, I don't need to look at that evidence. If it's presented to you, you'd look at it and study it and consider it in differential diagnosis?
Sure, it may or may not apply, but I'd look at it.
Because if you did that and said, well, I don't need to look at this, and it was relevant evidence, that would defeat the whole idea of differential diagnosis, correct?
Well, you always want to look at all the evidence that's going to help you decide what happened to the body.
If you were to ignore relevant evidence because you already made your mind up, that could create some type of bias, even if you're not recognizing it, correct?
Well, I don't make my mind up. I make it up on all the evidence I have. Then if something else other evidence comes up later, I have to reevaluate everything and consider that new evidence.
When you were talking about car collisions, I don't want to belabor the point, but you didn't major in physics, did you?
In what?
You didn't major in physics, did you?
No, I took physics, but no, didn't major in it.
Okay. And the last time you took physics was probably, what, undergrad?
Correct. Thank goodness.
You have no study in biomechanical engineering?
No, I'm not a biomechanical engineer.
Understood. You never taught courses in accident reconstruction, have you?
Only in terms of looking at the injuries on the body and showing how that they could or could not have occurred from impact with a motor vehicle.
Have you taught classes in accident reconstruction?
Only as far as it would affect the findings on the body.
Do you know what I mean by when I say accident reconstruction?
Well, accident reconstruction meaning, and I'm telling you, that my expertise in accident reconstruction is restricted to looking at the body and then understanding how impacts may or may not have occurred to the body. I don't take a car and look at mileage and such like that.
You don't do any studies of the actual vehicles, you're focused on the body?
I'm focused on the body, but I also look at the vehicles to look at the points of impact that might be possible.
You do not have any advanced study in biomechanics, do you?
No.
Okay. Now, you had mentioned that when you were in the medical examiner's office, you had a number of higher profile cases.
Well, every case is important because somebody's dead.
You pointed out some pretty specific ones on direct examination. Were those more important, the ones that were highlighted, or is that the same as every other case?
I don't know what you're talking about.
Well, you had mentioned the Egypt airline crash, station nightclub fire. Those were highlighted or pronounced on direct examination. Are they equally important as every other case?
Oh, absolutely. Every person is my patient.
You talked about some of your commendations. The station nightclub fire, you received quite a bit of criticism on that, didn't you?
Well, there was a flurry of negative press without any basis.
You had mentioned that a doctor, a medical examiner, should have gone out to the scene to look at the area where John O'Keefe was found to make observations. Did you suggest that in any way on direct examination?
You have to know what the scene looks like, and usually that is documented in police reports and in police photographs who document the scene.
The station nightclub fire, that had numerous victims, didn't it?
Yes, 100.
And you received criticism because you were repeatedly requested by emergency responders and police officials to come to the scene, and you refused?
That's incorrect. First of
Okay.
all, nobody called me to come to the scene, and medical examiners are not first responders. As soon as I got a call that there was that fire in the nightclub, my investigator went right to the scene, and I was in constant communication with him throughout the early morning hours of that horrible accident. And I went into the medical examiner's office because I had to start getting ready to run our office 24 hours a day to not only take care of the poor individuals who expired in the nightclub fire, but also the regular work of the medical examiners. So there was no need for me to go to the scene because I had my investigator there, and my job would be at the office to get things all set up to handle the influx of deceased.
Did you receive criticism that over 17 hours there was an effort to have you come to the scene, but you refused?
There was,
Going around in a different.
yeah, that's incorrect.
Hold on,
Oh, I'm sorry.
Oh, no, I didn't mean to steal.
Oh, okay.
Hold on for a second.
Okay.
Ask it differently, Mr. Brennan, please.
Did you receive criticism that officials?
I'm going to allow it based on the ending, pursuant to the ending, let's get it.
Did you receive criticism that for over 17 hours officials were asking you to come to the scene and you refused?
It was untrue. It was printed in the newspaper. We looked up all the phone records and provided it to the newspapers and showed that nobody called me to go. I would have gone if I needed to. I had my investigator there. It was just bullshit. No, it was erroneous stuff.
Was there other criticisms in 2005 before you left the office?
There was a flurry of stuff in the papers. There were union issues, new director of health, new governor. So yeah, there was a little flurry of stuff, which was not substantive.
So you inevitably did resign in 2005.
Yes, because my budget was going to be cut, and I knew that if I had to get rid of a medical examiner, we couldn't do a good job for the state, and I'd done it. I'd been chief for 12 years. I'd been on call 24 hours a day for 12 years, which was an honor, really. But then if I couldn't do a good job, if we cut the budget, I had to get rid of a medical examiner. I couldn't serve the people of Rhode Island well, so I resigned.
Did you resign shortly after the audits and criticism?
No.
Same year?
Oh, I don't even remember.
After you resigned, you opened your own company?
Yes, I started an independent consulting practice.
How much of your business is consulting?
It's a consulting practice.
Yep. How much of your business, how much of your income is
100%.
consulting?
It's consulting.
Do you consult in both criminal and civil cases?
Yes, I do.
What percentage of cases are criminal cases?
Maybe half and half.
Half criminal, half civil?
I don't keep track of it in that way, but that would be a guess.
I'm sorry, I'm sorry, I didn't hear you.
I don't keep track of numbers of civil or criminal cases that I'm consulted in. If I had to give an estimate, it would be half and half. I've worked on over 1,000 cases in my private company.
And fair to say you get compensated for your time.
Yes, I get paid for my time.
Dr. Laposata, you had mentioned that there were some scratches that you had taken a look at on Mr. O'Keefe's body. If we could have Exhibit 165, please. Now, would it be fair to say, Dr. Laposata, you do not know the genesis of that cut on Mr. O'Keefe's right eye?
I do not know what caused it. I can tell you what didn't cause it, but I don't know what did cause it.
You said that was from blunt force?
It's from application of blunt force to that little area that broke the skin.
When you were asked a question about whether that was consistent with a punch, you opined that it was consistent with a punch, yes?
It could be consistent with a punch.
You weren't saying it was consistent with a punch to a reasonable degree of medical certainty, were you?
That would be within my differential diagnosis.
It could be consistent with all other types of blunt impact, or many other types of blunt impact, couldn't it?
That's correct.
Ground, perhaps?
No.
No, an object?
If it was an object that could get into that area under the eyebrow, yes.
You mentioned the spoiler on the back of Miss Reed's Lexus. Do you remember that?
I remember that.
Do you know how tall John O'Keefe was?
He's around 7 foot, 5'11", I think, 7'2", something around in there.
No, he's more closer to 6'1". Does that make sense?
Sure.
Okay. And that spoiler on the Lexus, do you know how high off the ground that is?
No.
Did you ever try to measure it or ask for photos or any information about that?
No, I looked at the photos.
Did you ever ask for any measurements or try to take any measurements?
No.
Could I have Exhibit 166, please? Did you see this cut on Mr. O'Keefe's nose?
That's a scratch. It's not made by a sharp instrument. It's not a cut. It's a scratch.
Is there any scratches on the left side? Do we have a photo of the left side? Please. And that, you say that's a scratch, not a cut?
Correct, because a cut means it's made by a sharp thing, like a knife, and a scratch is made by something that's kind of rounded that has a little point on it, but it's not sharp.
Do you have any information or basis to say where that scratch came from?
No.
Did you do any differential diagnosis on that scratch?
I don't know what caused that. There could be a number of things that caused it.
There was no scratch on the right side of Mr. O'Keefe's nose?
I don't see it one, no.
Could you zoom in, Ms. Gilman? So the only scratch is on the left side?
Looks to be, that's not a good photograph because there's some blood obscuring the skin.
Yes.
If my memory serves me, there is a scratch on the left side of the nose and maybe a small scrape on the tip of the nose.
And we can go back to the left side. And you said that could not have been caused by a sharp object?
Correct. It's not an incised wound. Incised wound means a bladed sharp cut. This is a scratch, not made by a blade.
Were you aware the defendant made a statement that she pulled a piece of glass from the defendant's nose?
No.
And you would say that that wound is inconsistent with being caused by glass or a sharp object?
It would not be caused by a blade. It could be caused by a piece of glass that was thick.
I thought before I offered you that statement, you had said that it could not have been caused by glass. Do you now have a different opinion?
I don't remember saying it couldn't have been caused by glass.
Didn't you say it couldn't have been caused by glass or a sharp object?
A sharp object.
What
Like a sharp object, like it's not an
take that down,
incised wound made by a blade. It could be caused by something sharper that's thicker, but does not have a thin blade. So it could be caused by a thicker piece of glass.
If somebody is deceased, does any blood pressure from their heart still move in their body?
No, they're dead.
If somebody removed a sharp object like glass from somebody's face, would they spurt blood if they've died?
If you're dead, there's no blood pressure. So if you're dead and you remove something, there may be some superficial blood, but it's not going to have blood flow because your heart's not pumping blood out of the cut ends of the blood vessels.
So it's not going to spurt if you pull something out of a person's skin if they've passed.
You wouldn't get a spurt of blood from arterial pressure.
I just want to ask you a very few questions about hypothermia.
Sure.
You mentioned that Mr. O'Keefe's body temperature at the hospital was 80 degrees,
Yes.
and there's different ways to take somebody's or body's temperature, isn't there?
Yeah, that was a rectal temperature, so that's a good representation of the body temperature.
Is the variance between a common practice of taking temperature by somebody's mouth and rectal, is it about a 3 or 4 degrees difference, or do you have a different experience?
It can be different. A rectal temperature gives you a better internal body temperature. The oral temperature, if you're breathing in or if you just had something cold in your mouth, may not register a proper temperature. So the rectal temperature is the preferred temperature for a medical diagnosis.
98.6 is an important temperature, isn't it?
Yeah, it's our usual normal body temperature.
And so, is there a standard? Is 95 degrees considered hypothermic?
If you have, then clinically you would start to worry that the person might be experiencing bad effects of hypothermia.
At 95 degrees?
At 95, you start to worry about it.
And could some of the things that happen is labored breathing?
Is what?
Labored breathing?
What about labored breathing?
Well, if someone is hypothermic, if they're 95 degrees, does it affect their breathing patterns?
Not especially.
Okay. Does it affect the way their respiratory system works?
No.
Does it have any effects on the human body if you're hypothermic at 95 degrees?
No. You're still okay.
If that temperature continues to decline, it starts to become dangerous, doesn't it?
It can.
Mr. O'Keefe was evaluated, and at the hospital, his body temperature from a rectal reading was 80 degrees at about, 6:37?
Correct.
Did you know that before he got to the hospital, first responders had him in an ambulance?
Of course.
Did you know they turned the heat up and put blankets on him and tried to provide warmth to him before he got to the hospital?
Yes, that would be standard practice.
And that standard practice would usually add temperature to the person, wouldn't it?
Well, it might.
So it's possible it could, but it might not.
It usually doesn't add that much.
I see. And so inevitably, at 6:37, Mr. O'Keefe's body was 80 degrees.
Yes, when he got to the hospital, his rectal temperature was 80 degrees.
And so that is a drop from the standard, or what's expected of 98.6 degrees. That's a drop of at least 18.6 degrees.
Yes.
You mentioned that Mr. O'Keefe, after suffering his head injury, would not have moved other than twitching.
Correct. No purposeful movement.
Were you aware that he had an iPhone with healthcare data on it?
No.
If there's no movement, assume for a second there's no movement of Mr. O'Keefe after 12:32:16, and he's found a little after 6 a.m. in the morning. That's about 5 hours or 5.5 hours, correct?
About.
And if somebody is in the cold for 5.5 hours, that's consistent with dropping from 98.6 degrees to 80 degrees in body temperature, isn't it?
If the person is dead, yes.
If a person is outside in the cold and still alive, will their body temperature decrease?
If they can, people can die of hypothermia, but that's not the case here.
Not the ultimate death, but if somebody's outside and they're alive and they're lying in the snow and it's below freezing, will they lose body temperature?
They will, especially if they're not bundled up well.
And body temperature can drop from 2.5 to 4 degrees an hour?
In a dead body.
Okay. In a living person, it can drop 1.5 degrees.
No. A dead body at room temperature will usually lose body temperature at like 1.5 degrees an hour. If a dead body is in a cold environment covered with snow and avalanche environments, the dead body can cool at 4 degrees per hour.
And so a person who is in cold conditions, starting to be covered by snow, less than freezing, they can lose body temperature when they're living, can't they?
If you're sure, you can. People die of hypothermia, but that's not the case here.
Well, someone could be alive, lose body temperature, and not die. That can happen, can't it?
Yeah.
Right. So if someone is in the cold, let's assume they're not dead for a second.
All
They're in the
right.
snow, below freezing, not moving. Can that person lose body temperature if they're still alive?
Sure. They just lie there. They can become hypothermic and die.
Even before they become hypothermic, can they lose body temperature?
Well, losing body temperature makes you hypothermic. Thermic is temperature and hypo means below. So your temperature goes down and you're hypothermic because it's going down.
And people can survive from being hypothermic if they get the right care.
Sure.
And so in that 5.5 hours, it is consistent with a person being outside in the cold and starting at 98.6 and ending at 80. That's consistent with being in the cold for 5.5 hours, isn't it?
For a dead body, yes. That's how a dead body would cool in a snow-covered cold environment.
And it could also be consistent with somebody who is alive for some time and then dies, correct?
I don't understand your question.
Somebody could be out in the cold, under the snow, sub-freezing. They could be alive for some time. Their body temperature would drop. And then when they pass and die, their body temperature could continue to drop probably at a more rapid pace. That still fits within
No.
5.5 hours, doesn't it, Dr. Laposata?
No.
Oh. Because if someone can drop 4 degrees of body temperature in an hour,
A dead body.
yes, it would only take about a little over 4 hours if it was at 4 degrees to go from 98.6 to 80. Yes?
Correct, yes. So he was exposed to that cold environment for 4 to 5 hours.
If somebody was alive for a couple of hours, it's a lower rate, so you'd lose 3 degrees. And then, after that couple hours, they lose body temperature at 4 degrees. That would still fit and be consistent with the drop from 98.6 to 30 degrees, to 80 degrees, wouldn't it?
No, you were saying a dead body cools in a cold environment at maybe 3 to 4 degrees an hour. And that has nothing to do with a living body and how long they can stay at a body temperature.
Do you disagree that somebody could be alive, lose body temperature, out in the cold, freezing temperature below 32, they could lose body temperature at a certain rate, then die, and then continue to lose body temperature? Is that possible?
Anything's possible. It's just what's important is what happened in this case.
I'm asking for your medical opinion, though, rather than to be an advocate. As far as your medical opinion,
So sustained, and I'll strike that.
as far as
Dr.
your,
Laposata,
Yes.
would you listen to the question, please?
Of course, thank you, Your Honor.
as far as your medical experience, could somebody be alive, outside, in the cold, below 32 degrees, not moving, covered by snow, still alive, and lose body temperature?
Sure,
And then could they, after an hour, 2 hours, could they then die and continue to lose more body temperature?
sure.
You mentioned your opinion about injury on Mr. O'Keefe. And at one point you said that his injury was inconsistent with a taillight, and you said because there was no damage from the bumper. Do you remember saying that?
I don't think I said it quite that way.
Okay. Do you remember how you said it?
No,
Do you remember discussing or raising the issue of a bumper as part of your equation, that the injury to Mr. O'Keefe was inconsistent with the injuries?
he has no injuries on him that are consistent with being hit by the back of the SUV. That includes the spoiler, that includes the bumper.
Okay, if we could play video E, please. I want to ask you, Dr. Laposata, have you seen this video before?
No,
Thank you. You can take that down. Did you see anything in that video that would suggest any contact between that mannequin and the vehicle's bumper?
I'm going to see you at sidebar on this for just a minute, please. All right, so jurors, I am going to strike the last bit of questioning of this witness and the video as it goes to this witness. All right.
Dr. Laposata, after you received materials, did you ever ask for any additional materials?
let's see, I always make sure I have all the scene investigation, autopsy, medical records, police and witness investigate and witness statements. So I felt I had a pretty complete database. I didn't get the x-rays until a couple weeks ago, so that was delayed.
That was newer?
Yes.
You said a medical examiner has to make a determination in 90 days. Is that the rule?
When you work at a medical examiner's office, when you get a deceased in, our national standards want us to have the autopsy report completed and all the associated tests done within 90 days.
Can investigations occur and the additional accumulation of evidence happen after that 90 days?
Oh, sure.
Thank you, Dr. Laposata.